Experience holiday cheer at Tanger Outlets with savings up to 70% off your favorite brands. From fragrances to accessories and the latest styles, discover the best gifts for everyone on your list. Save big at Nike Factory Store, Michael Kors, Under Armour, Coach, Polo Ralph Lauren, Kate Spade New York, and so many more. Unwrap the best at Tanger Outlets. Hundreds of brands, endless gifting options. Plan your trip at Tanger.com.
Now, being that it's Monday and the pandemic is still with us, so is our good friend Dr. Dennis Norem from Mercy Health to discuss the pandemic and all the related things that go along with that. Dr. Norem, good morning to you.
Good morning to you guys.
How's everything going this morning?
Sorry to hear about the weather. It's going to be a nice sunny 75 today here in Tucson.
Oh, boy. You know, that's one of the reasons you moved there, so you can stick that knife in the ribs of the people who live back here.
I have to take advantage of it. I'm sorry.
Don't be. You know, I had a brother-in-law who lived in Key West. You know, once winter struck, we'd hear from him every couple of weeks with just him telling us what the temperature was.
How are things, guys?
Yep, it's what you do. It's what you do. And we can accept that to a point. All right, let's move on. You know, we looking at the entertainment options that are available today, Dr. Norm. There are so many different ones. You've got Disney Plus, you've got Discovery Plus, you got Paramount Plus. Now we got Delta Plus. I don't believe it's a streaming network. What exactly is this Delta Plus variant that people are buzzing about now?
Well, it's a variant that apparently is affecting somewhat in England and the UK, and the CDC is following that to see what the effect is going to be potentially here in the United States. So far, they're kind of downplaying that it's going to be a problem, but it is a concern. They're not sure yet if the Delta variant is more contagious and going to be more of a problem than the regular, the Delta Plus variant is going to be more of a problem than we've already seen with the Delta variant. The hope is that the Delta variant is similar enough to the Delta Plus that what we're doing now is going to continue to be successful. I think I saw it's about 6 to 10% of the new cases in the UK. So something to keep an eye on.
And how quickly after a COVID positive diagnosis do we get to find out if it's Delta Plus, if it's any of these variants? Is it quicker than before? I know we talked earlier about it's a little bit difficult to determine. Are we getting better at that?
I think we're a little better at that. I think you could probably expect that within a week or so they can identify these new variants. But again, they have to be sent to specialized labs, university labs, and I think obviously the CDC in Atlanta does testing. But I think in Illinois, the state contracts with some university labs to do the testing of these subtypes.
Yeah, it's just another one of those. I saw when the buzz started. You started seeing Delta Plus, Delta Plus, Delta Plus, Delta Plus. Now, at this point, did you? It's primarily confined to Britain.
That's my understanding. I don't believe that it's a problem as a significant outbreak in any country. I believe it's been identified in some other countries in Europe. But again, it's just kind of sitting back there waiting to see where it's going to go.
Is this more lethal, more contagious, more affecting different groups than previous variants, or do we not know quite yet?
Don't know yet.
Okay, we're waiting.
Don't have the info yet.
But it is something, of course, we will continue to gather information on because, like I said, it seems to be the buzz now in COVID-19 talk. Speaking of, I don't know if you saw this or not, but interesting release saying COVID-19 hospital airborne transmission prevented by air filters, according to a study that is making that suggestion.
Well, that's encouraging. Now, there was a thought that HEPA filters that would screen out the very small aerosols would be effective. But again, it takes a while to actually come up with a good study that would indicate that that's the case. So that is encouraging that filtering the air with good filters can be effective.
Yeah, Nature recently reported on the study, currently not peer-reviewed, to be the first to demonstrate how portable high-efficiency particulate air, that's HEPA filters, can reduce hospital transmission of detectable airborne COVID-19 virus in a real-world setting.
Again, a very, very encouraging fact. And I think it's consistent with the fact that we know that Delta has been able to spread much more rapidly and certainly much more frequently on aerosols. You know, at the beginning, we were all concerned about droplets, but aerosols are probably the main problem with the Delta variant.
Boosters, a lot of booster news popping up recently.
Yeah.
The term mix and match, keep hearing that a lot. I think that's something we've talked about a lot on the show previously. Should you know, if you have the J&J, should you go get the Moderna? It sounds like that's where we're pointing towards. Who's approved for a booster, and do we know what flavor we should be getting?
Good questions. As you probably know, this past week, very busy at the FDA and CDC. They've approved boosters for Pfizer, of course, which was already approved. Moderna is now approved, and J&J. What they're saying is you should get a booster for Pfizer and Moderna at 6 months. J&J anywhere from 2 to 6 months after your last dose. And they allow people to mix the boosters. So the question is, should you mix the boosters? What's the upside? What's the downside? And after discussing this with some of my colleagues, one colleague of mine actually did the mix of the booster, I think it's a reasonable thing to consider. I don't know if there's any advantage to mix the messenger RNA, the Moderna, Pfizer. There may or may not be an advantage there, but there's clearly an advantage if you had J&J to take a messenger RNA vaccine, Moderna or Pfizer. Even though the FDA isn't recommending that, I think that's a very reasonable thing to do. And you'd say, well, what's the downside? Well, the downside is you know what your reaction was to your initial vaccine. So I think most people have confidence when they get their next shot, they know what to expect. Once you mix the vaccines, you may or may not have a more aggressive or a worse reaction. That's probably the only downside.
If you're coming from an initial J&J vaccine and you do switch over, is that still just a one-shot booster, or are you doing the 2 shots?
Just a one-shot booster.
Okay.
All right.
Good to know.
Yeah, you need a scorecard to keep some of these straight.
Yeah, and one more scorecard. You said, if you have the J&J, your booster is being recommended from 2 to 6 months. Is that something you talk to your doctor about?
It's a minimum of 2, just like it's a minimum of 6 months on the Moderna and Pfizer. So if it's been more than 2 months, you can go ahead and get your J&J booster.
And in all permutations of people and vaccines, are they all open to it, or are we just 65 plus? Who's available? Who can go sign up for one today?
Well, J&J was only approved for 18 on up, so you have the people that have J&J would be 18 on up. Everybody else was approved for the 12 on up, and so that would be the only limitation, would be the age-related situation.
Okay, and I guess just one more. Are we waiting for a note in the mail, or is this a proactive move by those to get the booster shot?
I think people should feel free to go get your booster. If you're eligible, go get it. Okay. You can get it virtually anywhere now. Any pharmacy, I think, has it. Certainly the big pharmacies have it. I know our health system has rolled out booster clinics that employees can show up and get their booster. So be proactive. Go get it.
Yeah, don't wait for a call. Don't wait for a note in the mail in case that's what you thought the protocol was, that someone would call and let you know, or you go to the mailbox and go, oh, it's my turn. Feel free to go ahead and be proactive, doing your own math on when you go back from when you got your initials, right?
Right, and be sure and bring your card with you that shows your previous, so that they can record that information and give you an updated card.
All right. Now, I'm asking for an opinion on this one, but, I'm reading enough and seeing enough people jump in and opine on this one. What's your thought on this as far as COVID goes? With COVID, in one variant or another, is this something that's going to be with us now ever after? Is this something we're going to look at just like we always looked at the flu?
It's kind of looking that way as these new variants pop up. I think we're probably going to see this. It's just not clear what the cycle is going to be. We're kind of, locked into this flu cycle. It's seasonal, and we see it in late fall, early winter, typically. Nobody really knows what the cycle on COVID is going to be, but I think we're going to be stuck with it.
Why wouldn't the COVID cycle mirror the flu cycle as far as seasons go?
Good question. I guess I'm not enough of an epidemiologist to know. I'm not, but I'm pretty sure nobody knows right now what that cycle is going to be.
Okay, I'm just glad I asked questions nobody knows.
Yeah, right. There's a lot of those being asked.
Yeah, there are.
There's a lot of those being asked, and there's a lot of. Is there an answer to this? There might not be an answer to it. Just like the one I just asked Dr. Norem to opine on. Is this something in 20 years? It's that time of year. Get your flu shot. Make sure you get your COVID booster, and let's move on. This is just going to be part and parcel of the lexicon going forward.
Well, it reminds me of that old saying: the more we learn, the less we know.
Mm-hmm. Yeah. No, that's been very apparent
right
from the beginning of this.
Very apparent. But as far as kids vax goes, we were talking about the different ones for kids. Pfizer came out about 3 days back saying their COVID-19 vaccine is more than 90% effective on kids, and they're talking about preventing symptomatic infections in the 5 to 11-year-old set.
Yeah, again, very encouraging. I believe the FDA meets this week to potentially approve that, pass that on to this recommendation from the CDC, and hopefully we'll see that out the first week in November. That seems to be the timeline, unless there's something very unforeseen that pops up.
I know you're basking yourself in that warm Arizona sun right now, Doctor, but it's just your attention maybe pointed back here for a second. How are our local hospitals doing here with, ICU bed rate, admittance? Where are we at locally?
From what I understand, it's been kind of stable over the past few weeks. Our own system said that they're somewhere in the 10 to 15 patient range, which is very tolerable, very able to handle that at this point. That compares to when things were bad. I think they had something in the neighborhood of 80 COVID patients at one time. So it's still significant, but it seems to be kind of stabilizing. And overall, I think our numbers in the state are dropping or continue to drop.
Yeah, as far as our vaccination numbers here in the state, Illinois population 12 plus fully vaccinated, we're at 6.8 million or 63.4% of the population. 8.7 million or 81% of the population have received at least one dose.
Yeah, that's encouraging. We're still not where we need to be, obviously. We should be at 90% plus vaccinated, which is a little discouraging. And now we're facing the situation where immunity is waning and people are getting boosters. But hopefully we're not going to lose ground because people will not get their boosters and keep their immunity up. That is a concern.
All right. Well, and that's where, let's see, any other numbers? 18 plus. Oh, the senior population, you're most vulnerable, fully vaccinated. 1.6 million or 78.9% of those in Illinois 65 plus. 96.8 or 1.9 million of the 65 plus have received at least one dose.
Again, encouraging numbers. And as you well know, the new cases tended to be a lot younger because of the people being less vaccinated. So I think we're doing fairly well with our older population.
All right. Keep it going. Dr. Norem, as always, we appreciate the time. We appreciate the expertise. When we see variants added with a plus next to them, gives us an idea that we're not jamming the brakes on this anytime soon. So we'll look forward to getting together with you again next Monday if you're willing.
Absolutely.
We'll talk to you then. Okay.